¿Cómo estás, mamá? ¿Bien? Muy bien. Señor, what's up? ¿Cómo anda?
Bien. Dr. Jorge Camina is on a mission. He wants to make sure Leo and his sister Lupe get the medical care they need to thrive in school and society. And he wants to see to it that their single mom has all the information and resources she needs to help them lead healthy lives.
I think the biggest help that we've been to mom, if anything, has been just being there. The mom has other issues on top of Leo, social issues that affect her daily life. Not that we solve it, but we point her in the right directions. We give her some of the resources that we can, whatever little we can help, and we get the job done.
El doctor, como profesional, se desenvuelve en su rama y aparte de lo que él es como el pediatra de mi niño de cabecera, a veces vengo a pedirle consejos como padre, aparte de lo que él es el médico, porque soy madre soltera y a veces vengo a pedirle orientación por mi niña, por mi niño, y gracias a él siempre cuento en algo que vengo a comunicarle o...
Dr. Camina is Chief of Pediatrics at the Healthcare Network of Southwest Florida, a nonprofit organization which provides primary health care to residents of Collier County, Florida, regardless of their ability to pay. He works with more than 275 other professional and staff members who share his passion and commitment.
We keep parents working, we keep schools functioning, we keep the kids doing what they do, learning and getting better, because we try to keep them healthy for as long as possible.
We were founded primarily to serve rural, underserved populations, migrant, seasonal farm workers, and that was what we did initially, which is why we are located in Immokalee as our administrative and clinical headquarters. Over the years, we have evolved and branched out and moved all over the county, and today our patients are a cross-section of everyone in our community, friends, neighbors, our hospitality industry, the growers, the farm workers, everyone that's putting food on our table and taking care of our hotel rooms and helping our tourism.
Of the roughly 45,000 patients a year served by Healthcare Network, more than 30,000 of them are children. It's the largest of the network's 4 main service areas: children's care, family care, women's care, and dental care. Since its founding by community leaders more than 35 years ago, Healthcare Network has evolved into an organization that embraces the concept of a patient-centered medical home, an integration of biological, psychological, and social sciences aimed at both prevention and treatment of illness. Simultaneously, the organization has grown from one small Immokalee operation to 13 clinics and sites strategically located throughout Collier County to treat underserved populations from all walks of life. Over the years, the network has developed strategic partnerships with leading healthcare and social service organizations in order to expand its services and enhance the quality of care. For example, a partnership with Ronald McDonald's Children's Charities led to the creation of the CareMobile, a mobile unit which goes to schools, community centers, and neighborhoods in rural areas to provide primary dental, vision, and medical treatments. A partnership with the University of Florida's Dental School led to the establishment of a dental clinic on the campus of Edison State College in Naples. And yet another collaboration with Florida State University's Medical School has resulted in a permanent on-site pediatric clinic in Immokalee next to the network's main clinical facility.
FSU College of Medicine was established by the Florida legislature with the specific goal of training more primary care physicians for our state to serve underserved populations. And we define that as rural populations, minority populations, geriatric populations. This site provides our student with a very mission-consistent clinical site where what they are learning in the classroom comes to life. They can see patients from different backgrounds, different languages. The culture is very different from them that have a number of barriers in their access to care. And they then are able to learn not only about how to listen to the heart of this patient, but also to listen to what's going on in the patient's lives to better access care and serve them.
Well, what we follow here is the biopsychosocial model, which means that when a patient walks in the door, we're looking at the biology, We're also looking at the psychology, and we're also looking at what social needs that person may have. So we feel that it's really important to address each of those aspects because they're interrelated. You know, things that are going on socially are going to affect the biological well-being of a person. So if a provider only focuses on the biology, they may not realize that something social or something psychological could prevent that patient from either adhering to the treatment as prescribed or even getting better from whatever illness they're struggling through or trying to recover from.
Our physicians are a very bright and quality group of individuals. They're board certified physicians that understand what the needs are of our patients. They're very supportive of our patients, and I think the other part to that is that we are on the cutting edge of medicine. There's probably no other physicians in the community that are any further advanced than we are in terms of technology and the quality that we provide to our patients.
One particular technology which contributes to both patient safety and high-quality care here is electronic record keeping, which was installed in 2005. The technology allows the network to participate in the National Meaningful Use Program, which provides financial incentives for organizations to adhere to a strict set of guidelines for handling patient information. All 13 of the network's clinics also meet or exceed rigorous accreditation standards set by the Accreditation Association for Ambulatory Health Care, and all physicians are either board certified or board eligible in their specialty.
Everyone that works here is either an internal medicine physician, family practice, pediatrics, or a women's health physician. They're taking care of very complex patients with a very serious need for health care and continuity of care. And they are patients who are extremely appreciative of the care that they receive.
It's not only just coming in and seeing the physician and getting diagnosed correctly and then given the appropriate medications, which is what most doctors are expected to do. We have to go beyond that, in that we have to make sure that the individual has the resources to obtain their medications to treat their conditions. We have to make sure that they get the appropriate laboratory tests and analyses done or get them to the appropriate place. We have to provide transportation for those issues. We have to hand walk them through their different specialists and tests that they have to undergo so that we can make sure we're treating their conditions appropriately. And often we have to try to find out, financial support or resources to help them cover these things.
Healthcare Network is supported by a combination of patient fees, reimbursements, federal grants, and generous philanthropic support from local individuals and organizations. Audited results show fully 95% of the budget goes directly to patient care. As America struggles to usher in a new era of healthcare based on prevention and patient-centered care, it's good to know there's already a network of caring, dedicated medical professionals taking the first steps toward making that vision a reality.
I can look at myself in the mirror and realize that, we are making a difference, and that's, I think, why most people are here.